Mace, our county health director, and who has a special guest with us today, Dr. Steve Harrington, the superintendent of schools for Sonoma County. And before we get to their talk today, as part of this community briefing, we want to invite members of the public as well as our friends in the media to submit questions for our panelists. And you can submit questions by emailing them to publicaffairs@sonoma-county.org. That's public affairs, one word, @sonoma-county.org. Or you can leave a question in the comments area of the Facebook feed. So we will get to those questions at the end, but for now we will start with Dr. Mace. Dr. Mace?
Great. Thank you very much, Paul. Good afternoon, everybody. I'm Dr. Sundari Mace, Sonoma County's health officer, and I have our update on coronavirus as of September 15th. We now have 6,777 confirmed cases in Sonoma County. Those include 1,786 active cases and 4,881 people who have recovered. We also have a total of 110 deaths, which represents no change over the last 24 hours. Now we have completed 155,285 coronavirus tests to date. Sonoma County remains in the purple tier of California's blueprint for a safer economy. This is the most restrictive level, and it's based on two metrics. One is the daily cases per 100,000, new cases, that is, per day per 100,000, and the other is our test positivity rate. The current data and information about the tiers can be found on the County of Sonoma's roadmap to reopening on the SoCo emergency website. The latest data shows that we are now at 11.2 cases per day per 100,000 population. We need to be below 7 to move into a less restrictive or the red tier. Our test positivity rate is 5.3%, which is low enough to move us into the red tier. However, the state system requires us to meet both the metrics for 2 weeks to transition to the next level or the red tier. As you can see, we are making solid progress, which is encouraging. However, in order to ease restrictions, it's important to be diligent about following all the safety measures and protocols to slow the spread or transmission of COVID in the community. We'd like to share an update we have this week about schools. The State Department of Public Health is working closely with the Sonoma County Office of Education to determine guidelines for specialized in-person instruction. Although we remain in the state's purple tier, recent improvements in our latest case rates mean that we can now consider waiver applications from schools for in-person learning under specific conditions. Those conditions were spelled out in a letter that Dr. Steve Harrington, Sonoma County's superintendent of schools, and I sent out to all schools on Monday. I will begin reviewing these waivers tomorrow. For example, schools must submit comprehensive plans to address a spectrum of different safety topics. Each school must also consult with their staff, parents, and community organizations about how to address critical concerns, such as doing their own surveillance testing and contact tracing if they have a COVID positive student or staff member. Some of the other key areas that require detailed plans, as outlined by the California Department of Public Health, include the following: the regular cleaning and disinfecting of classrooms and facilities, the flow of individuals through entrances and exits and all other movement within the school, mandates about face coverings and other essential gear, healthy hygiene practices, physical and social distancing, staff training and family education, triggers for switching to distance learning if a class or the school must quarantine, and communication plans for parents and staff. The state of California is urging schools to focus on providing specialized targeted services for English learners, students with disabilities, students requiring access to the internet and devices for online learning. The state is also asking for plans for those who are most at risk and have the highest need, including students experiencing homelessness, neglect, or abuse. Based on state guidelines, schools must also limit learning cohorts to 14 or fewer students. And they must have systems in place for preventing these different cohorts from mixing. We're all concerned about the impacts of COVID-19, the pandemic, on education, and we're eager to see our children back in classrooms. But it's important to remember that the reopening of schools, public or private, for in-person instruction ultimately is determined not by me, but by where Sonoma County stands in its efforts to slow the spread of COVID-19. It's really up to all of us to slow the spread enough so that students can be back in classrooms and stay in class. So today, I would also like to share with you some slides that we put together through our epidemiologists and our disease control department to share with you the latest update on schools in terms of our COVID cases. Paul, are you able to see my slides okay at this time?
Yeah, they look great. I think everybody can see them. Thank you.
Okay, so we've had a chance to take a look at our own data. As you know, we like to follow data-driven policies and practices here in Sonoma County. So we want to see what's going on in our school and child care centers. So let me see if I can move this down just a second. Okay, so this gives us an idea of our child cases. That's defined as cases occurring in people under the age of 18 by the report date. And you can see this is from the very beginning of the pandemic. So we have had a lot of cases in children between the ages of 0 to 17 over time. There have been some particular dates when we've had a lot of cases. I can tell you that the majority of cases occurring in children are in households. And the majority of child cases are contacts to people in their household, parents or other relatives, and they get diagnosed because, as you know, here in Sonoma County, we are testing all contacts to cases. And so we test all kids in households, whether they have symptoms or not. And that's where the majority of cases have come from. However, we have also had some outbreaks or cases in schools and child care centers. So far, we've had 12 schools and child care facilities that have had known cases. We've had 3 clusters of more than 5 cases, at least 5 cases, and 1 cluster with 30 plus cases that's ongoing at this time. So in total, we've had 62 cases in child care settings or in schools that provide daycare, even though the majority, as you know, all schools are closed for in-person learning at this time. However, you know, the state has had a provision for child care centers and for schools to also provide child care. So of these 62 cases, 25 have occurred in students, 10 have occurred in staff, and 27 in parents or siblings. You can see here there's been a breakdown in terms of geography of these cases really occurring throughout Sonoma, 2 facilities in North County, 7 Central County, 2 in East County. And exposures have occurred on site. So you can see here that we've had 5 early care and learning centers with the majority of students, 19, 5 staff members, and 11 family members. We've had 3 elementary schools, here it's been mainly staff, 2 staff members or 1 family member since the kids are not in school at this time. And then we've had 5 child care centers in family homes with 6 students, 3 staff, 15 family members. Looking a little bit closer at the clusters that I've described, in the early care and learning centers, we've had 1 in North County that's had 30 cases as of September 15th, 16 students, and it looks like one of the students was actually the first case, 3 staff members, and then 11 parents or siblings. This outbreak is ongoing, and we have at least 11 contacts that are still pending. And the facility has been closed down for a 2-week period, which is what is recommended by the state when you have this many cases in one facility, as many of you would understand. The second cluster is a family child care home in Central County, and there's been 9 cases, 2 students, 1 staff member, and in this case, the staff member was actually the index or first case, and then 6 parents or siblings. And the cases have now been closed and quarantine has been completed. The third cluster was also a family child care home in Central County. And again, there were 9 cases, and the index case was again a staff member with 3 students and 6 parents or siblings. The facility was closed August 14. The cases are closed, quarantine completed at this time. And looking overall at cases that have been reported to us, an additional 9 facilities, elementary, middle, and high schools, have been mentioned in case investigations. 3 of these facilities were in Central County, 5 in North County, and 1 in South County. These schools are currently still only giving remote learning, but they have a total of 16 students, 2 staff, 15 family members with confirmed cases. There are 381 cases in that age range of 0 to 17 that are still under investigation by public health and our EPI team. So this kind of gives you a breakdown of what we're seeing in schools and in childcare facilities, whether they're in family care homes or whether they're in schools or facilities. And this is when we still have not at this point really heard or approved any waivers for K through 6 in-person education. So I just wanted to set the stage for that. I'm going to sharing my slides at this time. I'm done with my presentation. Thank you very much.
Great. Thank you, Dr. Mace. We'd now like to go to Dr. Steve Harrington, our Superintendent of Schools for Sonoma County. Steve, do you have something you'd like to say?
Yeah, I would like to share. First of all, thank you, Paul. First of all, Dr. Mace and I have been working and meeting regularly once a week on case reviews as it relates to students, schools, and operations. And that has been a very collegial and cooperative partnership, and I want to acknowledge that. We are both empathetic and supportive of parents and the stress that they're under. We know that distance learning is challenging for both child and family, and that's why we have set up several contacts on our own SCOE website for emotional support and during these trying times. Compound that with the fires and the smoke, it's been hard on everyone. And so I want to acknowledge that we're not taking a position of recommending anything other than just safety first and foremost. First of all, everyone needs to know that children are a protected class. And so when you look at a store operation versus a school operation, it has a higher standard protocol. You cannot compare a school to Home Depot or Raley's or Safeway. It's not applicable. Just like schools are built to a higher standard than a regular house or home or facility store, because we have the Field Act. We have to meet a higher standard because of this protected class. Knowing that, the state has set the standard. Neither Dr. Mace nor I have set the standard. The state of California has set the standard. And so what I'd like to share with you in a few minutes is our tiered structure of support for schools. But one of the question you need to realize is that even if a school chooses to reopen, because the state, although it says in their guidance that they would provide support to schools with contact tracing, that's not in place yet. And because the state has promised to make testing available to the staff, that's not necessarily in place. The state has also directed healthcare providers to provide testing to school employees because they are deemed essential workers. That has been difficult to accomplish with some of our contract vendors, such as the medical providers in this county, because they're really saving their testing for exposed cases. But should a school choose to reopen, they have to have teachers or employees tested 25% every week to be in efficient operation. And the other thing I hear oftentimes is, well, Marin and Napa are open. I don't know Mendocino's status, but they are also in the red zone, and we're in the purple zone. So, Paul, if you could bring up the chart, I'd appreciate it.
There you go.
Okay. So every district received this yesterday or the day before, I'm not quite sure, but it's the waiver process. So if you scroll down the waiver, you see that on the left-hand side is the tiers. That's the California Blueprint for Safer Economy. When you're in the purple tier, you can only apply into two areas. One is you can apply for a waiver for your TK6 student population. But as Dr. May said, you have to be below a 200 per 100,000 caseload. That didn't occur until just about the other day. And then the waiver request went out to all the districts and charter schools and parochial and private schools. Now, to give you a synopsis of our situation versus Marin and Napa, they both have about a student population of about 28,000 to 30,000. We are at 68,000 students. So our situation is going to be a little different. The other thing that you need to keep in mind when you look at these requests is that we have 53 charter schools, 40 school districts, and 41 private schools, several of which are the diocese parochial schools. All the information that Dr. Mace and I review goes out to them. Everyone's on a notification list. Everyone receives the same timely notice of information. But once again, we are only passing on the state requirements to the districts. When you look at it, to open under a waiver, which we could do right now, some of our small elementaries could do, and they have applications now are coming into Dr. Mace. They have to open up under all the health precautions that they would in a regular school, and then they have additional health cautions. They have to make sure that their criteria is listed for both a hybrid and traditional opening needs to be identified. They have to have all the health protocols in place. They have to have their waiver application and all supporting documents in case, and it has to be submitted at least 14 days prior to the desired opening. And that's a much smaller chart. But anyway, as you go down the chart, you see that there's a special needs population. Now, that special needs population tier process is you use a small cohort for identified special needs groups. It is not meant and does not meant to exempt or is not meant to circumvent the process of opening up a regular school. It is for special high needs populations. So a school could operate, but it must have all its protocols in place. So if there is a school out there operating for this population, they need to have everything on file or they're subject to state penalties. So once we get into the red tier, we move it up a little bit, Paul. Thank you. Once you get into the red tier, districts have greater flexibility. They could choose to go to a hybrid reopening model. Any model we choose to reopen has to have a circumference circle around each student of 6 feet and the teacher. And therefore, that limits the size of the class and the space involved in this situation. So schools could reopen in the red tier for in-person instruction when Sonoma County is in the red tier. That doesn't look likely, and probably to the end of October, maybe the 1st of November, but that's hopefully these trends can continue and we can see that happening. The reality is secondary students and their program doesn't fit this model very well, and that's going to be a challenge. The other thing that I saw in today's paper was the testing and the tracing. The state had the responsibility to do tracing. They're not expected to have their model up for schools till November. So if you open up now, you bear the cost and you bear the training. And should you have to go open up now, you have to go through the 25% testing. But if the state does not have expanded testing facilities within Sonoma County, then that burden is brought to the local insurance provider and or the local district. That's the challenge districts face. That's the challenge private schools face. And they have to meet the same requirements. Once again, the order covers both public, private, and charter schools. It doesn't exempt any school from the health orders. And then let's say we are in a hybrid model and we would like to look at the World Health Organization standard, and Dr. Mace and I, in our roadmap to recovery for schools, identified that we would consider this standard if we had positive health reports and results. Now, if you look at the child care preschool data, That's not encouraging. You can see the exposure rate of such few cases and how it's permeated the audience. And so these are concerns that every school board must decide. Remember, the decision to reopen is not rest with Dr. Mace. It does not rest with me. All we do is provide the guidance and the review protocols. The actual school board must wrestle with that decision. And one of the things that was brought up recently is liability insurance. Districts are not covered, and private schools are not covered under their insurance carriers for pandemics. So they operate at risk. And that's a dilemma that a policymaker must have to review when they go into this process. If you could go down a little bit further, it's not until you get into the orange tier that you can successfully look at opening up your high schools. And even then you have to look at the number of cohorts, because as Dr. May said earlier, you can't cross-contaminate cohorts, and that occurs more at the secondary level when there's a shifting between classes. All of that will be reviewed as we go down the economic indicators. So as we go from purple to red. One of the questions I've been asked is, well, if we open in red and we go back to purple, do we have to close? And the answer is no. You can stay operational. However, you are then subject to the quarantine standard, which is 5% of a classroom, you close the classroom. 5% of a school, you close the school. And if you have 25% of district schools contaminated by COVID, then you close the district. And the other thing that we have to live with is the reality of flu season. Flu season starts October. And the indicators are that this is a high-risk flu season as well as COVID. So all of these things are being played out at the local district, and everyone is trying to address these issues. But once again, our concern is the safety and well-being of students. They are a protected class, and both school boards and school superintendents are going very cautiously. That's what I'd like to share with you today. That's where we are today in this process.
That's terrific. Thank you. Thank you, Dr. Harrington. We appreciate you walking us through all those steps, because a lot of the questions we are getting are related to each of the steps and how they apply to public and private schools, K through 6 versus high schools, those kinds of questions. So we're going to go to questions now, and I'm going to start with one from John, who is a basic question. Please explain why it's okay to have kids in daycare, childcare facilities, but not in school at this point. Dr. Mace, you want to try that one?
Sure, thanks. I had to unmute there. Yeah, it's a very good question. I think that the daycare and the childcare facilities are very small cohorts. In fact, there's cohort guidance, as Dr. Harrington already pointed out, from the CDPH, California Department, specifying how large the groups can be, the fact that they all have to be there and not mix with other groups with the same staffing to student ratio. And I think part of it is because as we reopen there and people go back to work, that it's very important that we also provide for childcare. And I think the other big issue is socialization of young children outside of the household. I don't know if Dr. Harrington wants to add anything to that, but again, keep in mind, this is a state-led guidance, and we are not making the decision, for example, to open daycares, but not at the county level, that is. Great.
Thank you very much. Our next question is from Debbie. She asks, the Press Democrat recently reported that the school district, and you touched on this a little bit, recently reported that school districts will be responsible for testing and contact tracing. Will this just be during the waiver period? And once schools are permitted to open with the mitigations, will the county once again be involved with contact tracing?
Yeah, well, as you know, we are involved with contact tracing. And, you know, we have a lot of work going on in contact tracing in all kinds of different settings, different sectors, that sort of thing. To the extent that we're able to take on the work, we will definitely provide technical assistance for contact tracing, even for schools if they have large situations. So nothing will change from the waiver process to when schools hopefully reopen in person. The school will still be responsible for identifying their case, reporting their case, and beginning the contact tracing. If there is a big situation, it's our absolute responsibility to step in and help.
Well, on that, we have another question about that, and maybe Dr. Harrington can address this. I am concerned that the obligation for contact tracing might be a burden on schools because it requires staffing, skill set, and the budget to do that. Is there going to be any help and support for schools to help in that area?
Dealing with the contact tracing, there's an online training component that Dr. Mace has made available to schools and school districts that's available to them. But the question is very valid. It is an increased operating cost to a district. It takes time, it takes energy, it takes staff commitment off of other responsibilities. So that is in place. But remember, and I would like to let the public know, schools are only getting funded at 67% of their regular funding because the state is deferring its payments to schools. So about April, most schools will be running tight on money. And so then we have to step in and make a loan situation available to districts to complete their year. There is no additional support. And that's why when you look at the state health document, it says the state will provide additional contact tracing and support to schools and to Dr. Mace. And it says that the state will provide additional testing. But that's not in place yet. And I don't know whether Dr. Mace has any idea when that might be in place. But if you choose to operate earlier than the state availability, districts are having to bear that cost.
Okay, well, great. Thank you for addressing that. This is more a specific question we've been getting today. Is tomorrow the hard deadline for schools to submit a waiver? And is that just for private and public schools? And also is that just for K through 6 schools? That's my impression.
Yeah, that's kind of diving into the weeds a bit. So I'm going to see if Adam wants to answer that question. Adam Radke, who's our county counsel and been involved with the waiver process.
Yes, and I can also potentially assist in responding to the prior question. Starting with the prior question about contact tracing and testing, it's the position of the state that schools, in particular elementary schools, are not safe to reopen while the county is in the purple tier. The exception is that schools may apply for a waiver, but they must demonstrate a number of factors that can show that they can identify and control potential outbreaks that could occur in the school. And one of the requirements they must demonstrate in their own application per the state is the ability to test and do their own contact tracing. So that hopefully could clarify the last question and why that statement was included in the joint statement issued by Health. The other statement, if I recall correctly, is about. Oh, sorry. Can you repeat the question?
It had to do with the waiver, whether tomorrow was the hard cap for submitting waivers by schools, and whether that is for public and private, and is it primarily for K through 6 schools?
The waiver process is only available for K through 6, although if the school has grades that go above 6, they can apply for K through 6, but they, for example, can't apply for 7th or 8th. The starting date tomorrow is just when the health officer will start reviewing it. I think she would encourage districts to take their time in drafting their application and making sure that that everything that they need to put in their waiver that's required by the state is done. They cross their T's, they dot their I's, but it's not a hard date to submit it by Thursday. In fact, I think she would encourage them to take their time.
And lastly, it is actually for both public and private.
Great. Thank you for clarifying. We're now going to go to one of our media partners, Martin Espinoza of the Press Democrat. Martin, you have a question?
Thank you. Thank you for some of this data on the school outbreaks. One of the charts, I think it's chart 3, says has a total of 13 facilities in the chart, but it says 12 schools. Is there a difference between that 12 and 13?
Good question, Martin. I'm going to get back to you on that. Let me circle around with the epidemiologists and clarify that for you.
So my general question is a little bit of context here. Are we talking about all schools, public, private, child care centers, as well as preschools for this number, this dozen facilities?
Yeah, that would include all of the different facilities that have been reported to us or are associated with cases. So in the last slide, you can see we had an additional bunch of outbreaks, but they're associated and have been reported as part of other outbreaks. So it's a little confusing, and we can break that down for you if you like.
I'm wondering if you could give a little context. Is it surprising? Is it alarming? Or is this what we would expect? This number?
Well, we have COVID-19 cases in every sector. So, you can see we have over 6,000 cases. So they are occurring, in agricultural, in businesses, that's retail, wineries, really every kind of business. So it's not at all surprising that we'd also have cases in these daycare centers and early learning centers. I don't think COVID is selective that way. I really think that obviously it's just going to be transmitted from person to person. I don't think it's surprising, but I do think it's something that gives us a little pause when we think about going back to reopening schools, which is why I think the state has this tiered system. It may be harder to implement mitigation measures such as facial coverings and social or physical distancing, especially among younger kids in these settings. So I think that's where it gives us a little bit of pause, I think. I don't know if Dr. Harrington would like to add anything to that. We're working very closely in this whole process.
I would add, Martin, the fact that you increase the population base to this exposure rate, you're going to see that profile, that those tier systems, you're going to see us move back rather than forward. So the idea is to keep your exposure rate small so that economic rate factors can move forward. So it's a very tight balancing act, and that's why Dr. Mason and I have both sent out a cautionary letter to go slow. Don't speed up the process. Make sure you have all your preventatives in place. But we're both recommending or asking districts we're advising districts to go slow, to look at the reality. You're going to add another compounding factor. You're going to add flu into this. That pretty much starts in October. So now you've got two variables of exposure besides reopening schools. Our only concern for both of us is the health and well-being of our children. And so that's where we're coming from.
Thank you.
Okay, before we take another question, I'd like to go to Jose, who's going to give another reminder for our Spanish-speaking viewers. Jose?
Sí, queremos decirle que si quiere ver esta presentación en español, para escucharla por Zoom, vaya abajo de la parte de la pantalla a la derecha, donde verá el signo del globo identificado como interpretación y oprime para seleccionar español. También puede escuchar esta reunión en español a través de YouTube en el canal del Condado de Sonoma. El enlace está en la página del Condado de Sonoma. Gracias.
Thank you, Jose. Our next question concerns some of the reports that are out there, the news reports, like for example, the Santa Rosa City Schools District, I believe tonight is going to be considering some guidance that they may look at primarily virtual instruction through the spring of 2021. And I think the question from Manisha is it the recommendation of Dr. Mace and the County Public Health that all Sonoma County City schools not have in-person instruction through the spring? Do you have a position on that, Dr. Mace?
Yeah, I think it's just really hard to look into that crystal ball and see what's going to come at us here in the next few months. The important thing is to be flexible and to monitor our case rates, our situation, and see where we are. And so I don't think we can make that prediction, but I think Dr. Harrington would like to add.
Yes, Paul and Dr. Mace. Santa Rosa is only considering through winter break. They made their commitment to their parents that they would reassess at the first quarter. That's the first 9 weeks of school. They're at that benchmark right now, and they're going to evaluate the next 9 weeks of school. So the questionnaire said to the end of the year. That is not necessarily the decision. They're going to do it in increments because conditions vary and change. So they're not going for the whole year. They're only looking at it considering it for what we call the semester break, which is the next 9 weeks.
Yeah, I believe there might be some confusion there because I know that JC and Sonoma State have both said they'll be primarily virtual through the spring, but our local schools have not.
Right, and none of our local schools have made that commitment. They're taking it in increments.
Yeah. Okay. Adam from Roner Park asks, the initial lockdown was really, way back, was really meant to allow us time to stockpile PPE and ensure no there wasn't a run on ICU beds. So I guess this is a question for Dr. Mace. Since both of those issues have been addressed at this time, why the need for continuance of lockdowns? If the hospitals are still a concern, why have steps not been taken to add beds for this?
Right. So the initial reason for the shelter-in-place order was to limit community transmission of COVID-19. It wasn't really, PPE and, ICU bed availability was one factor, but it was really to minimize the spread of COVID amongst people in the community transmission. So in that vein, per the state order, we reopened. And what we found when we reopened in May was a worsening of cases, an increase in numbers that was actually pretty predictable, but we had to try it. And so I think now what the state is wanting to do is to take a more nuanced and slower, systematic approach to ensure that when we open, we can stay open and we don't have to go back again to more restrictive measures. The whole point of these restrictions is to limit the spread of COVID and try to protect people from really bad outcomes from COVID. And of course, it's our vulnerable populations, the elderly in the skilled nursing facilities, the residential care facilities, even at home, or the people with underlying medical conditions that are really having the worst outcomes. So we're trying to open safely to ensure that the entire community can be safe as we open.
Okay. And this question is another general question. This question comes from Wayne Freeman, who's one of our media partners. He says, and I think he's responding to a story that was in the Mercury News today, which I think might be dated on some old data, but he says latest percentages show Sonoma County to be the Bay Area's hottest COVID-19 hotspot. What has happened and what is public health doing about it?
Yeah, I don't think we're the hotspot, but we certainly do have, we're higher in the level in terms of the R0 or the transmission factor or rate. And one of the reasons, and we gave a pretty clear presentation why these might be the case a couple weeks ago. We're doing a lot of testing and a lot of testing of contacts specifically. And that's actually a really good thing because we're finding all of our cases. So that does definitely drive up our R effective because we're finding secondary cases, in other words. We also have a lot of factors that set us apart from some of the other Bay Area counties. We have the agricultural and farm worker group, which has been very heavily impacted by COVID, large households as well, and work sites. We also have tourism that it's not clear how much it factors in yet, but certainly if anybody has, seen what is going on, say on our holidays like Labor Day, we see that a lot of people are coming in from out of town to our county because it's a destination. And so I think in that vein, we are seeing that we have higher case rates, potentially higher test positivity. But the good news is we're doing a lot of testing, finding our cases, isolating our cases, and quarantining contacts. And hopefully we'll be headed in the right direction here soon.
Okay. We have some questions also just about the politicization of this issue, and how the whole issue of wearing masks has been a subject of discussion, particularly among our national leaders. Do you have a general statement about the importance of wearing masks that you'd like to offer? And
yeah, just that, it makes sense. When you have a respiratory illness that's transferred from person to person through coughing, singing, talking, through droplet nuclei, as well as in more direct airborne transmission, wearing a facial covering makes total sense to try to protect other people in the community and try to ensure the decreased spread of COVID. So I really highly recommend that everybody take that into account and do your part for the community and for yourself to limit the transmission and spread of COVID.
Okay, we'll just take a couple more questions and then we'll wrap this up. This is from a doctor in West County, Andrea, who she said she'd like to suggest a countywide plan for use of paper tests for contagiousness in addition to the current plan for diagnosis. She said it would allow us to open more businesses if people could be tested either that morning or at home or before entry into the business. She talks about the low cost of that. It would really be helpful for first responders and healthcare providers to be tested daily as well. Rapid tests is a great way to advocate for this at the federal level. Do you have a thought about that?
Yeah, rapid tests, some of them are really good and some are not as good, depending on the kind of test. The test, which has a great ability to detect cases if they really have COVID and ability to not detect cases if they don't have COVID, is in short supply. And we would love to have, infinite amounts of that testing, but we don't. We get 60 tests a week of Cepheid Gene Expert. The more recent rapid antigen tests have their place, and we are starting to implement them when we're doing routine surveillance in facilities like congregate settings, that sort of thing. We could even use that, say, in jails or other populations. However, they have higher false negative rates, and some have higher false positive rates. And so it makes it a little trickier to use those tests. But yes, definitely taking that under consideration. Thank you.
Okay. Martin, did you have a follow-up question?
Oh, there. Yeah, I did. Dr. Mace, I noticed you didn't name any of the schools that or the child care centers. I know that homes are an issue because they're private. A lot of these centers are private homes, but some of these are larger schools. Will you tell us the names of some of these facilities?
Yeah, at this time, there's so few of those facilities that we feel like it would really impinge upon the privacy of those schools, of facilities. As you know, there is some stigma associated with COVID-19 outbreaks, and so we're not planning to release the names at this time.
And my other question is, and this is regarding our cases, we have continually seen the last few days very low numbers of new cases. And then I think when you start doing the or the sort of cleaning up of the numbers for onset, the date of onset, the numbers might even go a little lower. Is it possible that next week we could see ourselves meeting we already meet the positivity rate for the next tier, but actually next week, do you think it's possible we might even meet the case rate?
Certainly it's possible. In fact, in the Bay Area itself, we've seen a decrease in case numbers over the past several weeks. I'm hoping that trend will continue and looking forward to seeing what happens over the next week.
Thank you.
Okay, I'm sorry that we're not going to get to everybody's questions. We appreciate all the questions that have been submitted and your involvement. We do invite everyone to join us again next week when we will be having these community briefings with Dr. Mace. One last question comes from Taylor. My question is whether gyms in Sonoma County will be able to reopen anytime soon. Dr. Mace?
It's a really good question and understand the concern. Adam, I'm going to let you respond to that because you're more familiar with the tiers and where we'd need to be potentially for gyms to open from the state.
Yes, gyms are allowed to operate outdoors, but if he is asking about allowing some indoor reopening, there is the state does allow a limited number of individuals to exercise indoors in a gym once the county is in the red tier, and it that capacity increases as the county goes into less restricted tiers.
Great. Well, what shouldn't be lost in this conversation is that the fact that waivers are now being considered is a positive sign. It means we are down to a number of cases where those can be considered. So overall, I don't think it's overstating it to say we're moving in a better direction, and it's a hopeful sign. So I thank you all for being here. Thank you, Dr. Harrington. Thank you, Dr. Mace, and everyone. And we will see you again next week.
Thank you.
Thank you.